Namaskar. Welcome to this module on inpatient services. In this module, we shall discuss about the components of the indoor inpatient services. An inpatient area is the part of the hospital which includes the nursing stations, the beds it serves, the storage and the public areas needed to carry out nursing care. Since it is a home away from home for a patient, it requires holistic planning and designing to suit the requirements of seekers and providers of patient care. The following are the main functions to provide quality and efficient patient care with minimal nurse fatigue factor, constructional and operational costs to be kept at the lowest possible without affecting the functionality, to provide the most durable patient care environment, to provide necessary amenities for visitors, to achieve job satisfaction for nursing and medical staff. Types of nursing units. A nursing unit consists of the patient space, nursing space and allied service and storage space may be of the following types: general wards, private wards.
So we are at AIMS and we've just seen the general ward. Now we are going to see a private ward. For privacy of the patients, we will not shoot inside. But what I am going to tell you is that there are A class room and B class room. Now there are 5 floors in the old private ward, and in every this floor there are 12 rooms. Now so what is the difference between a class room and a B class room? So A class room is on a higher end of the cost that a patient pays to be in the ward, and B class is on a lower end. So what's the difference? There is no difference in the patient care, only difference is the facilities that is provided in the ward. So what is provided in the A ward is anteroom is the difference, and there are little more facilities provided in the A ward. In B ward there is no anteroom, but apart from that there is a bed for the patient, there is a bed for the attendant, there is a washroom, and apart from that there is a small storage arrangement, and each room is separate. So one patient per room. This is also a type of a private ward. New private, that was old private ward.
Here also it remains the same, A class and B class. I have already showed you
Inside configuration is the same, but ma'am is telling you that this is a singly loaded corridor built around a open to sky courtyard, and so the internal configuration is the same, A class, B class. External configuration, there is a difference.
Isolation rooms, emergency wards, pediatric wards, maternity wards, psychiatric wards, geriatric wards, cardiology wards, orthopedic wards, neurology wards, neonatology wards and pre-operative and post-operative wards. Each of the units perform specific functions which necessitate the unique design considerations. The following are the common design considerations which may be incorporated, modified as per the specific requirement of each type of indoor care units, which I have given you before in this module, and we will talk in the subsequent modules about this also. So what are the objectives? The following are the main design objectives which must be emphasized during the planning, designing of inpatient wards. Design should follow the function: ensure privacy and safety for patients. Efficient nursing care should be provided with minimum nurse fatigue factor. It should maximize the usage of shared support services. It should be planned on a standardized modular grid, which is the planning grid, and the structural grid and the modules used for planning. It should provide humanized environment to the healing process. So, we should provide healing environments. A view to the outside, including those elements of nature, should be planned and designed for. It should harmonize with the functional requirements of the treatment and technology, as well as patient's physical and emotional needs. Specifications. Some of the specifications which must be considered are: the doors to the patient's room should open outwards into the corridor with an outside lock only. The toilet attached to the patient's room should be provided with a grab bar, an emergency call button. Door of the toilet should open outwards into the patient's room. Very important. In the infectious diseases ward, each cubicle should have a sanitary facility and utensil sterilizer in the pantry. It should also have a large dirty utility room for disinfecting the linen prior to dispatching to the laundry. The use of natural light through atrium in the waiting areas may be done. The minimum distance between the center of the beds should be 2.25 meters. Space at the foot end should be 0.9 meters, and the recommended space at the head end should be 0.25 meters. The pediatric wards should have additional facility for accommodating the mother or a family member. Electrical outlets should include reading light, nurse's call button and night light. Additional outlets for cleaning equipment and portable X-ray should also be provided, and there should be a universal remote to control all these switches. The nurses station should be located as centrally as possible to the activities of the unit and provide optimal visibility to the patients. Layout, design of the wards. The arrangement of beds in the wards is determined by various factors such as size of the hospital, type of services provided such as intensive care, rehabilitation, demands of the community. Nightingale, Pavilion type of wards. In such ward, beds are arranged perpendicular to the longitudinal walls. The nurses station is placed in the center of the hall and beds are placed in rows facing each other. Such wards are economical to construct and facilitate adequate patient visibility and cross ventilation. However, no privacy is provided to the patient in such a ward. Riggs ward. Such wards are in the form of cubicles of 4 to 6 beds each. Beds are arranged parallel to the longitudinal walls. It does provide privacy to patients, and it is possible to segregate patients according to severity of disease and types of sicknesses. In a unilateral Riggs ward, beds are placed in each bay and bays are separated by common corridor, whereas in the bilateral ward or two unilateral Riggs wards are located on either side of a central nursing station. In this type of a ward, nurses' walking distance for patient care activities is also minimized. T-shaped wards. In type of design, bed bays are placed in front of the nurses' station. Isolation rooms are on the both sides. Ancillary and services are behind the nurses' station. Racetrack or double corridor type of wards. In this, the beds are arranged in single or double room configurations. Courtyards. In this type of a plan, courtyards of varying sizes are inserted into the core areas to provide natural light and ventilation. Cruciform. This has a cruciform shape with the nurses' station in the center. circular. In this, the beds are placed around a nursing station. Area required for nursing procedures. In a high dependency unit, a space of 3.5 into 3.5 meters is required for 4 members of the team to effectively utilize cardiac and respiratory equipment. The recommended size of a low dependency unit is 2.4 meters into 3 meters. This space allows a 2-member team to function effectively with the nursing equipment such as the nursing trolley, the IV stands, etc. Lighting. The inpatient department should have glare-free lights. The following are recommended: journal illumination 150 to 200 lux, nurses station illumination 300 lux, examination illumination 500, 750 to 1000 lux. Water requirements. The water requirement in a hospital is 450 to 500 liters per bed per day. This excludes the water required for firefighting purposes. There should be a separate storage tank for firefighting purposes. It is recommended that a 3 days requirement of water should be available at all times as a reserve buffer stock. Electricity. The requirement of electricity is 2 kilowatt per bed per day, 5 kilowatt per bed per day for super speciality hospital. It should ideally come from 2 to 3 grids. Specific requirements. The specific requirements of various specialty inpatient units are as follows. Pediatric nursing units. The following are recommended. Provision must be made for toilets, sleeping facilities for parents who may be allowed to stay with their children. Isolation rooms along with anteroom should be provided. Approximately 20 to 25% of the beds should be single rooms for the critically ill patients. A playroom should be provided for group activities. A formula room should be provided with a counter and a sink. The decor and color of the walls should contribute to the cheerful physical environments of this space. Obstetrical nursing unit and birthing center. This should preferably be located on the same floor and in close proximity to the labor delivery units. It should have ultrasound scanning room. A day room should also be provided. Psychiatric nursing units. This should be a single unit equipped with tamper-proof fittings and accessories. Isolation rooms. The entry should be through an anteroom with various facilities for hand washing and gowning and storage of cleaned and soiled materials separately. Single bed per room. The main advantage of the layout is that the patient can rest undisturbed. The location of independent toilets also help to make the patients become ambulatory earlier. Let's conclude. The inpatient department is one of the most important facilities requiring planning and designing parameters conducive to the provision of effective patient care. Patients and their relatives, visitors should be provided with an environment that is caring, healing and humanizing. Namaskar. Thank you.